Hi, welcome to today's community chat. We're going to be focused on Autism Awareness Month for the next about 30 minutes. We have Dr. John Harrington, who I'm going to hop on in just a second, joining us today. And please put any questions that you have in the chat, and if we don't touch on it, I'll be sure to look at it. And then just to note, afterwards on WAVY.com, there will be resource links and the article with this conversation if you're watching it at a later time. So I'm going to bring on Dr. Harrington. Hi, Dr. Harrington. Thank you so much for joining us today. You know, as I said, this has been a conversation that we've been wanting to have, especially in the month of April, but obviously relevant in other times of the year. But just wanted to take the moment to highlight this. And I just want to give you a brief introduction because as CHKD said, you wear a lot of hats. So you're the Vice President of Quality, Safety, and Clinical Integration at CHKD, and also the Division Director of General Academic Pediatrics in Norfolk, which is a CHKD medical group where you're also a pediatrician for over 25 years, if that's right.
Yeah, somewhere in there.
We don't have to talk about it.
I don't
But
care.
if you just want to, maybe give the viewers a look at, how autism touches your life, either professionally or personally.
Sure. I think, I'm glad it's Autism Awareness Month. A lot of people, sort of realize that autism has become very common. And I think when I was a resident or medical student and stuff at that time, I was told I might see one child with autism in my career. And that has changed dramatically. So when my son was born, and he was not talking and he was having lots of difficulty after his first birthday, I was worried, and I became extremely worried because nobody else seemed worried. And so at that time, I sort of went to the professionals at that time, and they kept saying, well, he just has a language delay. It's, nothing more than that. Don't worry about it. And I said, he does a lot of these other things, though. He's very perseverative in the things that he does. He wants to watch the same video piece over and over again. And he had language and now he lost it. And, I'm really worried. He doesn't sleep anymore. He has lots of problems with relationships. He hates other people. He avoids them all the time. And, finally, I was sort of like, I think my son has autism, and they were just not willing to sort of say that right away. And so, move forward quickly. Now he's 27. He did finally get a diagnosis early on in his career, but it took about 2 years to 3 years to get a diagnosis that was autism. Most of it was mostly language delay. And I'm like, I kept saying he has autism. And so, so finally I realized, this was in 1997, 98, things started happening. There were a lot more kids getting diagnosed, and there was a lot more stuff going on in terms of the autism spectrum world. And I think one of the things that you found, which was interesting, was that, we had this thing called the DSM-4, and then it switched to the DSM-5, and that was in 2013. And we thought, well, now that we've really gotten these, diagnostic criteria set, we're going to start limiting the amounts of kids diagnosed with autism, because these new criteria are a little more stringent. We won't be diagnosing everybody who has some sort of language delay or everybody who has some mild intellectual disability and blah, blah. And then it kept skyrocketing, right? So now we're talking about, 1 in 25 boys born today will have autism. And it's probably higher because that's based on 8-year-olds that we're looking at now and stuff. And for girls, 1% of them born today will have autism. So, and that's probably higher too. And so, when we think about these things and we say, is our healthcare system, is our whole system, like when they grow up, when they get bigger, when they go into employment, when they're kind of, teenagers, do we have the resources and ability to to sort of provide, structure and resources and abilities for kids with autism to thrive? And I think for me, that's my, $1 million, $1 billion, whatever question you want to call it, moving forward and stuff. And I just find it really, overwhelming at times, but also I see it as a goal, as a goal in life to sort of make those things happen for all of those families and all of those individuals with autism. And I think a lot of people have gotten, to sort of say, you know, um, everybody with autism, sort of has their ability to be who they want to be, right? And how they want to sort of perform in life and stuff. And I think there's been a lot of back and forth, but there's really no like, this type of autism and that type of autism. It's sort of, it is unique and each child is different and stuff, but we all want them to achieve, right? We all want them to get to a point where they can, be the best that they can be.
Absolutely. And you're seeing that increase, in data, that you've sent to me from the CDC and the MMWR. But,
Mhm.
is that data that you also, maybe in real life are seeing in your practice or seeing in this area with colleagues?
Yes, 100%. So, and again, the data that they're taking from, from the CDC and the MMR are based on kids who are 8 years old. So you have to think about it as data that's 8 years ago, but it's based on kids who are 8 years old now who have a stable diagnosis of autism. Now, if you said before the pandemic and after the pandemic, we're kind of seeing a bit of an increase in autism after the pandemic, at least from the perspective of practices and people sort of, even talking to me and stuff. And I will bet a lot of money that our rates will continue to go up. And I'm not doing that as a like we're all the sky is falling, the sky is falling. I don't know why. And everybody wants to know why. I don't know why. We have a lot of things that are occurring, right? There's a lot more digital devices. There's a lot more activity and nativeness about digital devices with kids and stuff. I don't know how kids are interacting with, now we had all these masks on, right? And so a lot of our, kind of socialization is based on eye contact and facial features and things like that. Did that have anything, did that have any changes and stuff? And I think we're realizing that, maybe not, I don't know. But we do have a lot of stuff ongoing that seems to not be changing. It's not going down. I don't think it's staying stable. I think it's still going up. So we will be talking about this probably next year and the year after and the year after, and we'll probably be seeing increases. And and people start thinking about it like, well, this is, I think they call it Autism Acceptance Month, right? It's sort of like, I think we just have to accept that that's where we're headed. But I'm not really sure why. And so I think, from our standpoint, really do need to kind of be more accepting of the fact that some people are going to be different. And they call it neurodiversity is the sort of terminology for it and stuff. But we do have a lot of people that are just different. And I think they're different for many different reasons. But the acceptance of that and the ability for us to kind of look into that and say, you know what, they're just different. And, we can have acceptable social cues, but we may have to accept other social cues as well. And so I think that's an aspect that it's very interesting to me in terms of human behavior and human psychology and stuff like that. And, I started out being a pediatrician. I initially wanted to do psychiatry, but I wound up doing, pediatrics and stuff like that. But I was always fascinated by behaviors and by emotions and by what drives us and stuff. And I think it's really interesting with autism and stuff. They have different motivators in some cases, and sometimes you just have to figure out what that is. And if you find the right motivator for them, they can be outstanding individuals in their own right and stuff. And I think that's some of the patterns that we do for the acceptance. Is sort of, I accept this as their behavior, but if I can channel that to this, they are unbelievable at that. And so it's one of these things where if we learn how to do those types of things, we may see major breakthroughs in certain areas that we might not have.
One question I had that sort of might lead into a different question is, is one of the reasons we're seeing increases that, this scale is opened? I know that you said that there actually are even stricter parameters really with that DSM-5, but I think we did talk about, are more races and ethnicities being diagnosed? Are people seeing it and maybe they're not saying, oh, it's not just language delay, and so or it's not ADHD or whatever, maybe the misdiagnoses were earlier on? I mean, does that have any play into it?
Absolutely, Sarah. I think, we've gotten better at diagnosing. We have eliminated most of the, social determinants of health that help diagnostic issues because we screen everybody. And then we, create the ability for them to get further testing and further diagnostic testing a little bit easier, and eliminate some of the hurdles about getting to different practices and getting those practices in different areas so that those parents can get to a diagnostic process. That's what's been interesting about the data on it, is it's showing like all ethnicities, all races, and all different demographics are increasing. It's not just someone who can get to that care and stuff. Excuse me. And that's, I think, some of the driver of this is that the kids that are getting diagnosed equally across the board. The delays in the diagnosis are also decreasing. So for all people too, because I think that's another thing that people are kind of working on to try and fix that aspect of, access to care and things like that. And I think here at CHKD, we definitely trying to do that. We had grants for the Act Early, which was to get earlier diagnostic processes, and we put those into place, especially for kids under age 3, to try and get them expedited into evaluations and stuff like that. So yeah, a lot of work around the country has occurred, and the 11 or 12 sites that they use to base this on are all across the country and stuff.
And, that Act Early program and this idea of, knowing earlier intervention, maybe earlier, programs and resources for the kids. I mean, how important is that, especially in an age where you can either learn things quickly or, things are changing very quickly, you're growing? I mean, how important is that?
Things, we've always been about the earlier the better, right? So early intervention is just that. It intervenes early. Your plasticity and neuroplasticity and ability to sort of grow. We're not changing you. And so some parents get worried, like, well, their autism is who they are, but it's not. It's how you adapt and change to physically work through the world and stuff. And so, my son really didn't talk until like he was 3 years old. And even then it was just a few words. And but it started with someone who was doing, I guess, ABA type therapy, which is applied behavioral analysis and stuff. And not that I honestly, you can say one therapy is better than the other or whatever. And I always said, it's not the therapy, it's the connection that your child makes with that therapist and in your parents and stuff like that, and whoever is interacting, that really makes the difference. And so, you can say, oh, it's this type of therapy, it's that type of therapy. It really is, does your child make a connection with this person? And is this person helping your child, right? And are they improving and socially making better connections and able to sort of make it through their day better, with less stress and less behavioral issues that cause them not to be happy, And so I think that's the kind of that's the way I describe it to parents. And generally it's true. Like you want to have every day, you want to be a wonderful day, right? And so it's one of these things where if you can make it that much better, even if it's like 20% better, that's better, And so it's a process. And if you told me that my son would be working today and he would be on his own for like 12 hours down at a shipyard with a bunch of other guys, loading ships on a dock and stuff, I would have said, no way, but now he does, and he likes it and he enjoys it and he makes pretty good money. So I'm a total advocate for, helping kids and adults achieve, right?
And you said this with your son, you were sort of talking about some of those signs maybe you noticed earlier on that made you think of autism. I mean, for parents out there who perhaps, are having kids or going to, I mean, what are some signs that they should notice? I know that you said maybe it's different in girls and boys, but, what are some of those signs that maybe you should bring up to a pediatrician?
So definitely, most of the signs that we see, parents have trouble seeing them early on, meaning like in 6 months, 8 months, kids may not have any signs, right? But they also may. There's some studies showing that they may. But generally around that 1 year age, kids should be saying something. They should be saying mama, dada, ball, baba, something, right? If they're really not saying anything, then they definitely need at least a hearing test. I've had 2 or 3 kids who were diagnosed with autism who couldn't hear, and deafness and autism can look similar early on. So definitely just get their hearing checked, make sure that they have good hearing, and then move on, right? And so that's one aspect. The second thing is poor eye contact. Like they don't look at you, they don't respond to their name. Like almost all of us respond to our name, even when we get older and we're on an elevator and someone says, "Hey, Sarah," but they're talking to the other Sarah, you are still going to turn and see if that person is someone that wanted to talk to you. With kids, it's the same thing. If you say, "Hey, John," if I don't look at you, I'm not ignoring. As a 1 year-old or a 15-month, you're not ignoring, like that. They don't do that. If a parent, well, he ignores me, I'm like going, yeah, kids don't really do that. They don't ignore you and stuff. If you say their name, they should turn their head or they should respond in some way. The other thing is they don't point for stuff. Like they don't do this, index finger pointing, right? I want that. I want this. I want that. I want this. They tend to drag you. It's called hand guiding. They tend to drag you to things. They drag you to the, refrigerator and then don't point what they want. They pull your hand to what they want. They don't think of it as they call this proto-declarative pointing. I want that, right? But they don't do that. They actually just use you as like as a robot to do stuff for them, right? They can have severe meltdowns based on things not going right. Like the parents are usually walking on eggshells, going like, "We just have to make sure that the video doesn't stop, otherwise they will lose it," right? And then they turn into like this melted butter, and you can't get them up, and so severe meltdowns, at a very, at a 15-month, 18-month level and stuff. A lot of kids have poor sleep habits. They don't sleep well. My son didn't really sleep much at all from 18 months to 2 years of age. And so it was one of these things where like, what is going on? Why are they having these things? And stuff. Those are some of the things. There's multiple others. Some of the kids toe walk. Toe walking, actually, 25% of kids with autism will toe walk, and it's one of these things that actually one of my medical students pointed out. He goes, "Well, how long does that last?" And I said, it lasts for a long time sometimes. Up until age 3 or 4, and sometimes they even need surgery because they never come off of their toes and stuff. And that's part of the sensory issues that you might ask me about later. But there's some sensory things that they do. They may be oversensitive or undersensitive, right? They may be oversensitive to noise, but they really like pressure. Or they may be, they like to do things over and over again, or they like to sort of, wave their hand in front of their eyes and do these, sort of sensory things that give them input that seems to be fun. Or it calms them. Some people think that, when you talk to older people with autism, they say, well, it calms me to do that hand flapping, or it calms me to do something that allows me to kind of center myself in some way and stuff. So those are the things that I look for.
And, moving to adulthood, and you talked a little bit about this with your son as well, and him working now. You've done some research or you've written some articles at least on obstacles that young adults face moving into that phase. I mean, what are some of those things when, is there a point where resources sort of teeter off, at least at the, the state and local level, and then you sort of have to figure out on your own, what are you going to do for your young adult son or, for your children as they get older?
Yeah, a lot of parents ask, what do I do? How do I move through this, sort of transition to adulthood and stuff? And, you know, when your child turns 18, depending on their level of intellect and their ability to communicate, they could decide, hey, I'm going into the Navy. And if they're 18, they can. And, you know, the parent would be like, well, wait a second, like I can't. So there's a thing called guardianship or limited guardianship things that you can do, you know, with a lawyer and stuff like that about, you know, how one makes decisions for themselves and stuff. You know, you can even make it for driving. You can make it for, you know, different aspects of their life. You know, and I think it can change over time. You know, my son probably can drive now. We didn't want him to drive initially because we were afraid about getting in an accident or something like that. But he probably could drive now, and he's mentioned that he would like to. So we may change that about his guardianship and stuff. And then, you know, certain things like you can stay in high school until 21 because you don't necessarily have to be shooed out of high school if you want to sort of still learn things and stuff. And a lot of programs have developed in the high schools that help kids transition to adulthood. You know, many of us sort of think about adulthood now a little bit differently because, you know, with the COVID and the Affordable Care Act, like we kept kids on their parents' insurance until 26. Why did we do that? Well, it's because people weren't growing up, right? They weren't leaving the house. So you know, kids with autism aren't really that different than most regular adults because most of the kids are, you know, taking a little more time to gestate into an adult, right? So 25, 26 seems like a reasonable age to move people into the adulthood world. But that being said, in the legal world, once you're out of school, out of high school, and you turn 22, you automatically become an adult in the service industry in terms of what services are available to you for your disabilities and stuff. And so since autism is considered a disability in the, you know, for SSI and for Social Security income and things like that, that becomes an important factor in terms of, you know, what kind of services are you going to get? Can you get assisted job coaching, you know, job assistance and stuff like that? So there are lots of different things, you know, related to, you know, developmental and aging and rehabilitative services that then become available to you as you move out of school and into the adult world and stuff. And a lot of parents don't realize this, and so they kind of go without services for long periods of time. The other aspect is that there are waivers. They're called developmental disability waivers, there's autism waivers and things like that, that actually help provide job coaches, community assistance, respite services and things like that parents don't know anything about. And so they need to be educated on that. There is a group called Tidewater Autism Society of America, shortened to TASA. That's a, you know, it's a national group, but there's, you know, a Virginia Beach location for that group and stuff. And they do a lot of the help, which is, you know, educational pieces like that, that has been very helpful to a lot of patients that I take care of. But I think they supply a lot of information in the area to the listening area of WAVY 10 and stuff like that, that can be very helpful.
And, you know, in terms of, you know, local resources and the way, you know, things maybe have evolved in the last 25 years or so that you at least have been, you know, aware of it with your son. I mean, how do you feel locally it is, like, especially with your son working and all, do you see in your patients or in different people that maybe their perspective of somebody with autism has changed? You know, do you think people are a little bit more maybe welcoming? I know that there are some celebrities now that have also talked about, you know, whatever support need they are, like they have found that loved ones or themselves have fallen on the scale. I mean, what are some of those things that you've noticed, you know, maybe that have evolved?
So the acceptance of autism is definitely increased. You know, people understand that, wow, like, you know, if 4% of all kids and boys have this, you know, it's pretty common, right? So, but the misperceptions still occur, right? So there's not like a, you know, and this is sort of one of those difficult things. There's really nothing facial feature wise or body type wise that tells you that a child has autism or that an adult has autism, right? There may be some oddities about their behavior that you may say, well, that's really odd, right? But but if you have to do that next step and say, well, maybe their odd behavior is related to their autism. Maybe that's why
Right.
they're
It's not
responding this way.
visual for them.
Right.
Okay.
So there's not those visual cues, and nobody wants to wear like a red letter that says A on it or something that I have autism, right? But I do have, my son does wear a wristband if he gets in trouble and with someone like the law enforcement, and says, look at my wristband, and the wristband has on it, I have autism, and if you need to call my parents, this is the phone number. And so in case he feels like he's being misperceived, or something's going on, he can use that to sort of help the law enforcement and stuff. And this has been a big issue, over time with other people who have, interacted with law enforcement, and something that we were working on diligently. Our last Insights into Autism conference that we did in February was all about like sort of getting law enforcement to understand and be sensitive to the fact that some people have autism, and that their actions may not be, in a bad way. It may just be that they have autism and they don't realize what they're doing. And so my son likes to talk to young girls. He's 27 years old now. When he was 12, that was okay, but he's 27 now. So if he talks to them, he still thinks he's young, right? And so that looks suspicious, right? And so this gets him in trouble all the time. So we said, you can only do it in our neighborhood. You can't go to another neighborhood when you ride your bike and do that same thing. So because someone's going to misperceive that. So we have to give him strategies like that so that he doesn't get into trouble just because he's acting his normal way. But to someone else, it may look like, hey, why is that 27-year-old talking to those 13-year-old girls? I don't understand. And so it is one of these things where he's just buying the Girl Scout cookies. He's really not doing anything else. But it is one of these things that can be misperceived by socially and stuff. So sometimes you have to say, we have to still be nervous about that because you're still worried, but you still have to say, hey, how you doing? Hey, what's your name? And if as long as it's done in sort of a non-threatening way, they're likely to say, my name's Sean, and I'm, talking, and it's like, okay, so you kind of get it. Once you start talking with him, you realize that he has a different way about him and stuff, and that helps. But if you're just looking at the scene and saying, what's wrong with this scene here, someone might perceive it as something else.
And I want to get into questions just before I let you go. But I guess the first one, and you sort of started touching on it with the neighborhood piece, is, what do you do, or what kind of support maybe did you want, or do you see that patients need for, their kids or families?
So a lot of times it's like, when my son was working at a facility in Chesapeake and stuff, they really felt like, well, we can't tell everybody he has autism. And I said, why not? And they're like, well, because that's his diagnosis and stuff. And I said, I think from the standpoint, you can ask him. And if he says you can tell them, then I think you can tell them, right? So I said, ask him. And he's like, Sean, do you want people to know that you have autism? Absolutely, right? So it's a self-determination issue. If a person with autism doesn't want other people to know, then they don't have to know. But if you ask your child, maybe some children are too young to ask, but if you ask your child, or other people want to know, like, why is your son, running out of the house and across the street naked? Well, but he has autism, and he got away from us for a second. I'm sorry. Thank you for helping us bring him back into the house and stuff. That happened to us in New York, and people were very helpful about it, even though it was 25 degrees out. So it was one of these things where things happen, and so you do have to talk maybe to your neighbors and stuff. Like, a lot of us don't talk to our neighbors anymore, like ever since even before COVID, but after during COVID, it was sort of like, oh, you're not supposed to. But it is one of these things where you need to be still socially connected to the people around you, and your neighbors usually provide a lot of support. Our neighbors protect our son, you know what I mean? They look out for him. They said, hey, I saw Sean over at such and such, is he okay? And I was, oh yeah, he always travels. Oh, thanks for letting me know. I never take it as a bad thing that they're watching out for him. It's always a positive thing and stuff. And it really is something that people in my neighborhood now understand, like, a lot more about autism because of him. And so I think it is a good aspect for people to do, because I think the more you learn about autism, the more it is easy to accept and understand and be part of that process and stuff. Because there's got to be a reason why kids are getting autism. And I think it's probably for a good thing, because my son is probably the nicest person in the world. And so that's kind of one of the things that it sort of takes you back to sort of like, he has an innocence to him and a social immaturity to him that makes children, like that's why we all like children, right? So it is one of these things where there's an innocence to it, but there's also some sides to it that can be difficult, because kids with autism who become adults and adolescents tend to have more issues with depression, anxiety, and suicidality, and stuff. So a lot of them wind up in the mental health system as well. And so that's something else that we deal with on the other side, because people don't accept them, and people do have problems, and it is harder to work through life with autism in some ways. And so I think that's part of the issue, is the acceptance will help those other patterns as well.
Thank you. And I mean, I think that's something that, could be a whole other, conversation, I think, just in terms of what, negative emotions for the person with autism that they can deal with that, you just sort of touched on. I think real quick, last thing I wanted to ask you about was, and this, I guess, goes into the piece of sort of welcoming people with autism. I think some people don't view this as an issue because there are heavier issues to tackle, but I think I've heard it a little bit that people, do have some commentary over this puzzle piece versus infinity sign, and but I've heard on one hand that people, don't worry about that as much because they would much rather other, issues be tackled. Not that it has to be one or the other. But I just real quick just wanted to hear maybe if you've heard anything or if that's something that's, come up.
Yeah, it's interesting. I think a lot of people, when you're dealing with a diagnostic process and stuff, or you're dealing with something that's unknown, I think, we were, when I do the Insights into Autism conference, we utilized a picture with puzzle pieces and stuff. And one of our people that was coming to the thing said, hey, you guys are a little bit out of touch. They're no longer using the puzzle pieces and stuff. And it was, I was surprised, and I was like, oh, I didn't know that. And so, because I never knew the generation of what the puzzle pieces were about, everybody has a different impression of symbolism, right? So the puzzle pieces were like, yeah, when you put all the pieces together, everybody does well, right? And it could be from collaboration, it could be from, making sure education and the socialization. And, I didn't feel of it like that it was a puzzle piece. There's a piece of puzzle missing from kids with autism, and that's why they have autism. I never thought of it that way. And I'm not sure if anybody else thought of it that way, but there were some concerns about that. And then, some people have decided, well, maybe an infinity symbol might be better to show about acceptance and stuff like that, and make it a rainbowish color and stuff. And it's all about messaging and stuff. And the message is that, we know there's neurodiversity. We know that there's people with autism and people with different types of neurodevelopmental problems that, go through life and need help. And support systems and things like that. So I'm not beholden to any one symbolism of it. The issue with it is that if something is recognizable and it gets people to a place where they can get help, then go with it, right? But if you feel like it's denigrating or has some sort of aspect to it, then speak up and say, I don't like that. I honestly don't have any dog in the fight. I just feel like it's symbolism is symbolism, and so if you feel comfortable with this one, then I can wear both symbols for you. I don't have a way of sort of getting around that stuff. So my feeling is that whatever makes you feel comfortable is where we can go and stuff. And I like the idea of an infinity symbol with neurodiversity and stuff like that. I still like the puzzle pieces because I think of things a lot of times as in terms of collaboration of medical and educational and resources and community and stuff like that. They're all like little puzzle pieces that go together too. So however you want to look at that symbolism, you can make with it what you want, but there's no bad things about it, and there's usually only good things about it stuff in most ways.
Well, Dr. Harrington, thank you so much for spending so much time with us. We're at 11:35, so I know I went over a little bit, but I really appreciate it. And And to everyone who is watching or is watching this later, I did want to say that CHKD has provided some links for us and some resources just to start if you want to do any individual research after this conversation. So thank you so much, Dr. Harrington, for joining us, and really appreciate you being on today.
Thank you, Sarah. Thanks for giving me a chance to speak on
Absolutely.
Community Chat.
Yes. Thank you so much.
All right, take